All right, so we mentioned it's November. How many times have you seen the Joe Namath ad on TV and all these, Jimmy Walker, I think? Anyway, Medicare is everywhere, and trust me, I know. And we're going to talk a little bit about that with Lisa Monserud. She is with Faith Health Advisors. Lisa, welcome back to the show.
Hi, Pete. Thanks for having me.
How are you?
I'm good. We're obviously in the middle of AEP, so bonkers.
It's
so.
a little, it's kind of your time of the year, isn't it?
It is.
It's like, go. And
Yes.
you got to rock, you got to roll. And you've had some changes since the last time that we talked. You grabbed a pair of dice and you blew on them and said, let's do it.
Yes. I went independent and formed my own agency. So I'm still an independent broker and, in the state of Minnesota, also licensed in Wisconsin. So
Great.
Here we are.
Well, congratulations to you on that.
Thank you.
All right, so let's dive into it. What services do you provide at Faith Health Advisors?
So currently I am licensed in health and life and focusing right now, of course, on Medicare.
Sure.
We're right in the middle of the whole AEP, the Medicare, take a look at your plan, see if it's still going to work for you for next year. AEP, annual enrollment period. And
Okay.
I also, if there are, things that you need, financial planning, et cetera, I have strategic partners I can get folks partnered with so that they can look at the whole picture of their health and their wealth.
Right.
So
What's your age group of people that you're working with?
it's kind of every age, to be quite honest, because I also do not just Medicare, but the MNsure platform. So folks that are either self-employed or their employer doesn't offer health insurance, that is something I can also help folks with too. Or say you retired and your wife was on your insurance, but now you're retiring. So she's maybe got a little bit of time to catch up. We'd have you go on to Medicare. I'd help her with MNsure too. So
Sure.
it kind of works in a lot of different scenarios.
I'm not surprised that the age group is huge because, the industry of businesses offering health care is really changed. And I would say over the last 10 years, and it may be longer, maybe shorter, but people need to get out there, and number one, they need to be covered. And it is daunting to start that process. And that's why there's people like, Lisa, who can help them, because you're there to really just answer some questions, and no question is too dumb, is it?
You're right.
That's
You're
right. But you've got to have seen a lot of changes in the industry in your time you've been in play.
Especially, first and foremost, I have to say, with Medicare, those Advantage plans that are out there, those are the Part Cs, all the letters of the alphabet, A, B, C, all of it.
Right.
There's a lot of legislative changes that are coming for 2025.
Right.
Things inside the prescription drug side of things have been capped, different formularies, different tiers for medications. If you don't know what that means, that's totally fine. Call me, I'll explain it all,
And real quick, and we're going to talk about those plans, but it's November, and there is this window that occurs every year, right? When does that window, when did it open? Was it sometime in October?
October 15th.
Till?
It goes till December 7th.
Okay.
Any changes in that period of time, either for your Advantage plan or if you have what they call a Medicare supplement, also known as a Medigap, hopefully you have a separate prescription drug plan if you're on that Medigap. Those should be reviewed, the prescription drug side and the Advantage plan. Any changes that we do right now during annual enrollment, those will take effect January 1st.
And then it cannot be changed in that year. You're going to live with whatever you pick, correct? And then next October 15th, you'll have another window that would then look for the next year, correct?
Actually, no. There actually is another. There's
Really?
OE. It's called open enrollment. It's not very widely advertised, but January 1st through March 31st, you can make a change.
Nice.
Yep. Anything you do in that month, say you do it in January, it starts in February, the plan would, and vice versa, going down the line. So February, if you do a change there, then it would start in March. March, it would start in April. There's also, if there's any 5-star plans in the area, or if you, of course, have a special enrollment period, you move, or there's a
Sure.
whole list of different enrollment options.
All right, so we know what OE is. That's open enrollment. Tell everybody again what AEP is.
So that's this time that we're in right now, October 15th through December 7th. It's an acronym. There's a ton of acronyms that they have when it comes to Medicare and healthcare in general, or health insurance in general, but AEP, Annual Enrollment Period, very, very important.
Okay.
And especially because of those legislative changes, everybody should have a review done at least. Whether it's with me or their own broker or agent, they definitely should have their plan looked at this year.
In all your years, are there tweaks every year?
Yeah, there
Yeah,
are.
That's just the way it is.
The Advantage plans, those change, those are Part C. I always say, if you have a book, the supplement, the Medicare supplement, that is like the cover changes because the premium can fluctuate from year to year. The Advantage plan, what I like to describe to people is the story inside of it changes because these carriers, you know, there's 43, 47 different plans in this area. Of course, it depends on your geographic location too. But the big thing is they go through all of the, you know, primary care, specialists, how much is it to stay in the hospital? They look at all of those, break them all down into a copay or co-insurance,
Right.
and they move things around.
Yeah.
Change some of the extra benefits, the dental, vision, hearing. We don't know what they're doing from year to year.
Right. It just is what it is. All right. What is your process if I want to find out about the Medicare plans that I could choose?
So I like to sit down with you either in person or on the phone. I do a lot more on the phone, which we can do everything electronically now. Technology's great. I like to get to know you. You know, I'm the girl that on her report card had talks too much growing up. So, you know, it's about an hour initially. See how much you know about Medicare, see what your needs are. I don't work for the insurance companies. I actually work for you. And of course, you don't pay me anything for your services. So it's my job to get to know you so that we can break down those 40 whatever plans that are out there and find one that would fit you and fit you. And truly, what is good for you may not be good
Yeah, exactly.
for your wife or your neighbor or
Right. All right. Did I hear you say that there is no cost to work with you?
that's it. That's absolutely what I said.
Okay. Now that's very nice of you, Lisa, and I appreciate that, and I'm sure they all do too.
Yeah.
But how does that work? I mean, so where do you get paid?
Yes, excellent question. I don't do this for charity. I mean,
Right.
I love what I do. I want to be a blessing to others. I want to do right by you. And the nice thing is because as a broker, I am actually contracted with all the major healthcare companies in the state of Minnesota. I said earlier, licensed in Wisconsin as well, so carriers out there too. But the carriers are who pays me. And I get paid all the same, carrier to carrier. So it doesn't matter which company you choose.
Right. The customer
because-
comes first with you.
Yeah. And two, I like to stay in touch throughout the year. I always say, call me, text me, email me, anytime. I mean, like you said earlier, no question's a dumb question. I'd rather you ask it and not be ashamed of it versus wondering or, you know, not liking something or being in the dark.
All right, so we got a guy out there right now, and he's like, I could do this all on my own, that I'll read something and figure it out. Why would I choose, or that guy choose, to work with someone like you compared to maybe just trying to do it themselves? I know the answer. I think you do too. Let's hear what she has to say.
Well, and I do run across people that do it on their own, and it can be done, but I mean,
That's a full-time job.
Ooh,
How
I
do
mean,
you
exactly.
figure it out? I would be so I'm in a small raft in the middle of the ocean trying to figure that out.
it's big. I mean, I have a spreadsheet. I have a team, you know, people I can bounce things off of. If I don't know absolutely everything, there's just no way to know everything, but I have this massive spreadsheet. And if anybody knows me, I'm a spreadsheet girl. So it's color coded. It's got every plan for the north, for the south, east, west, every part of Minnesota. And like I said, it's color coded and it's got everything broken down. So I use that as a tool, but I mean, I do this every day.
Right.
So I'm not going to call up, you know, my doctor and say I'm going to do all that. I'm going to do my surgery myself. I mean, I'm going to call an expert. So
Exactly.
I hope folks would do the same.
Yeah. All right, so what if I'm not ready to retire, but I want to learn more about Medicare? I mean, I'm kind of right in that zone right now where I could.
Right.
Maybe I don't wanna, but how do I learn more about how that whole thing works?
give me a call. It's never too early to start the education piece. And I like to start with it. Like I had said earlier, find out what you know about Medicare. Some people know a lot, some people know absolutely nothing. I always like to start with that education piece and dive in. And I kind of overwhelm a little bit because there's a lot of numbers and a lot of moving parts, and it is confusing. And then we talk and see if you even need it yet.
Right.
Because some folks, if they're still working and their coverage at their current employer is what they call creditable, and the prescription drug plan, of course, inside of it is as good or better than Medicare, you may not need to. You
Right.
could keep working till you're 70, 80 years old if you chose to, and not necessarily have to take Medicare.
Right.
But that's something I like to give some tidbits. I mean, there's rules with HSAs. I'm not a tax preparer or anybody like that. I'm not any sort of tax expert. So I always say, talk to your CPA, or if you need one, I've got one. But really, dive in. Here's the questions we ask your HR department, or, what's your scenario? Like I said earlier, too. If you want to retire, but you're worried about what your wife's doing, I've got options for that, too. MNsure is great, obviously, for all ages.
Sure.
And, I mean, I even have moms and dads call me, say, my kiddo is turning 26. Can you help her or him? So, all ages.
Yeah, there you go. All right, so that guy that was out in that lifeboat with me out in the middle of the ocean, he said, I'm doing it myself. He wants to talk. He wants to have a conversation, and that's really is the first step in this whole journey, is just to do that, reach out, sit down, have a cup of coffee, and have that conversation. How do they get a hold of you?
So they can call me or text me. They also can email me. My phone number that they can call or text is 612-979-9709. And then my email is just lisa@faithhealthadvisors.com.
She's Lisa Monserud. She is with Faith Health Advisors. Hey, let her help you on that journey to get knowledge, to make decisions that you need to make when it comes to those very important issues that are going on in your life and with your family. Lisa, thank you so much. Next year, coming back?
Absolutely.
Yes, she will. All right, we're taking a break. When we come back, we are going to wrap up this edition of the Chamber Report, so stay tuned.